tell me a little bit about how you grew up. What's your background?
So, if I take it a step back, was born in Mississauga,
Mm-hmm.
Ontario. Was once a part of Toronto, and then our family moved to London. So London, Ontario is a couple hours.
Not London, United Kingdom.
Not London, the UK,
Yeah.
no. But a lot of times people always, confuse the two.
Confused
So
too, yeah.
London, Ontario, and then our family moved to Edmonton, Alberta.
Mm-hmm.
So really born and raised in Canada.
Tell me a little bit about Edmonton. I know when people talk about Canada, people know Toronto, people know Vancouver. Edmonton doesn't really get
Yeah,
uh,
I mean,
much notoriety. Tell me a little bit about it.
true. I mean, Edmonton's a small family city. The city has definitely grown. I mean, even just the tech and innovation scene over the last year. We've the city and the province built out this really nice state of the world art innovation center, which is pretty dope to see. Because once upon a time, our city was, I think, for the most part, really reliant on the big city Toronto, as you're probably aware.
Yeah, that's where people would
Most
want to go on their weekends and their
Absolutely.
trips and stuff.
Exactly. So even like when it relates to tech and innovation, a lot of people would make their way back to Toronto. So now it's nice that I think that infrastructure and that capacity, is happening in the city, and people are finding the ways to like Alberta, Calgary, Edmonton in particular. Yeah.
Okay, nice. So, what was it like growing up? Well, how old were you when you left like Mississauga and went to Edmonton?
Yeah, so I was in Toronto for about the first like 13 years, I'd say.
Okay.
Yeah, and then we moved to London,
Okay.
and then Edmonton was like really
How long were you
my
in London?
London. Not too long, not too
Okay.
long. We went like I think it was like maybe 6, 7 years, I believe.
So, did you finish high school in London?
I started, yeah. So I took grade 9, which was
Okay.
like first year of college, high school,
Mm-hmm.
and then finished high school in Edmonton. So it took like grade 10 to 12 plus university
In Edmonton.
out in Edmonton.
Okay,
Yeah.
so kind of like all over Canada, really, for K through 12.
Exactly.
Okay.
Exactly.
Which was your favorite?
Oh man, I mean, I think as an adult, probably Toronto.
Mhm.
I think, and like Toronto is actually like where the majority of my family, the family is. So all my aunties, the cousins, that's where the bulk of our family, is from. So it's always nice to, I think, as an adult, go back and like see exactly the place, where you grew up, and seeing those like memories,
Mhm.
right? Where now your aunts are still like around those same neighborhoods, and I mean the face of the city.
That's what feels like
And-
home.
Exactly.
Yeah.
I mean, yeah, Edmonton definitely, I would say home
Mhm.
today, but I think when it comes to like family
Mhm.
and connection, yeah, definitely,
Definitely.
definitely Ontario, London,
So
and Toronto. Yeah.
definitely. So you say family. What did family mean to you growing up, and what does it mean to you right now?
I mean, man, family is everything, right?
Mhm.
I think that's kind of like your foundation, you know? Uh, so it's nice. I mean, alhamdulillah, I think if anyone has, a loving, supportive family,
Mhm.
and the blessing to be brought up by a village,
Mhm.
of
It
family.
takes a village. That's what they
It
say,
really,
right?
really does. Yeah,
Yeah.
it really does. So I think like, my aunts, right? Like I remember even when we were in London growing up, right? We'd go to Toronto every summer.
Mhm.
And, when I was a young kid, like I remember my mom would send me in particular to Toronto because I was like always the active one
He was the one that was ready to go.
Exactly. I was the one who was just always active, man.
Yeah.
Like, so I'd be the kid where, it'd be like, you're spending the summer with your aunt. You're gonna, you're gonna help her with whatever she needs.
Yeah.
And alhamdulillah, like, I think those memories still, ring like
Heavy on you.
heavy, yeah, to
Nice.
today. Yeah. So,
So you said you finished your high school in Edmonton.
yeah.
What what were your interests? What was something that you saw yourself doing at that time? What was your view of the world? What did
Yeah.
take me into like kind of what you were thinking and where your head
Mhm.
was at when you were finishing school. You're in Edmonton. It's still a fairly new city for you at the time.
For sure.
You just finished high school. What did you really see for yourself, and what journey did you take from there?
That's a really good question. So I think Edmonton, our family and many families moved to Edmonton for opportunity, right?
Okay.
It was an economic boom around the time. So there's a lot of jobs, and we were able to get jobs to really help, really get ourselves opportunity, right? So in Ontario, I mean, the job market was really, really hard. So I was able to get a job at like the age of like 15,
Oh, wow.
14 at a coffee chain, Tim Hortons. And it was actually my
Classic.
older brother. Yeah, a classic. It was my older brother who went in for an interview, and I was like, I just plugged myself in. I was just like, I want a job too.
So your brother went for an
My
interview
brother
and you
went in
said,
for
"Give
the
me a job
interview,
too."
and
How did
I
that work?
literally was behind.
You were like waiting for his interview
I was
to finish.
waiting for his interview to finish just to
Yeah.
get myself in that door.
Yeah.
So I went in and I was like, I want a job. And they're like, 14, we're not really sure if we can hire you. Just wait it out a little bit.
Yeah.
So we waited it out, and then I was able to get a job like the next summer or something. And then I ended up staying there for like a lot longer than I probably should have. Like maybe like I think close to 10 some years
With Tim Hortons.
with Tim Hortons starting
That's
and it was a
crazy.
comfortable job. So I was
Yeah.
like the last 3 years of university, got promoted to like a supervisor. I was paying off some of my university.
What did you start as?
Coffee.
Coffee. So
Pouring up the
barista.
coffees, the
Yeah.
double doubles,
Yeah.
I mean, tossing it through the drive-through, and so basically I did that all the way throughout high school, and then through university. So it was allowing me to travel, see the world, pay off university, help my family, really get by, which I think is a story of a lot of people today. And then I was like, I've invested a lot of time in this industry, especially in this job. I'm going to actually go to the corporate side of things. So then I was like, after I get my degree, I want to work for corporate. I'm like, okay. So I started off selling coffees. I was able to talk to the owner, shout out to Kathy
Yeah.
and the team there. And I was like, hey, I want to be a supervisor. They allowed me to have that leadership opportunity at a very, very young age, where I was
Nice.
like supervising teams that were like 2 times, 3 times my age.
Yeah.
And then I was able to go to the corporate side.
Mm-hmm.
Got shot down the first time I applied.
Is the corporate side still based in Edmonton or?
Toronto. So
Toronto,
then
okay.
that allowed for me to move back to Toronto. But even before I got there, I remember applying and I was like, okay, I have this many years of experience. I got my university degree, and you guys shot down my CV. Like, what's
Yeah.
going on?
And I've been with your company for this
And I've
long.
been with
so
the
I
company for
understand,
this
like,
long. Yeah. And this was before the whole like diversity and inclusion. I think
DEI.
if that existed then, I probably would have gotten the job like right away.
DI wave.
Exactly.
Yeah.
So I actually had to plug myself in and go to a golf conference that I knew all the senior leadership would be at from Ontario to Alberta. And I was like, hey guys, I applied for this job. I volunteer at your children camp every summer. Like, what's going on? Right.
What gave you the idea, or even the confidence to just show up to that conference? Because usually most people, the reason I ask is most people, like, if they apply for a job and they get denied for it, they'll just be like, okay, it wasn't meant for me, and they'll move on.
Yeah.
But what gave you that like approach to say, no, I'm gonna go to the conference and see why they didn't pick me?
Well, I don't know, man. I think I just felt like I was so qualified for that role that I just wanted an answer. And if it
So you
was,
didn't want the job even, you just wanted to know why.
I think I definitely wanted the job, but I
Okay.
think I wanted to know the why even more. Because for
Okay.
me, it was like I've invested X amount of time in this. And I also felt like at that time, and I have a different perspective and view on things today, but at that time, I was like, I thought I had my life figured out.
Yeah.
I was like, okay, Khalid, you're going to go do this role. You're going to spend X amount of time doing this. And because you did A, you now got to do B, which is be a supervisor. And then you got to do C.
So you had it mapped out.
I had it mapped out. And then get into
Yeah.
corporate executive.
Yeah.
And then, plan life out in that way. So, I just pulled up there and I was like, hey guys, like, this is what happened. What was the conversation like? And I got an interview like the next day.
Wow.
Right.
Yeah.
So it was just talking to the right person, pitching, my story and my CV. And sometimes these like responses are automated.
Yeah.
Like, I don't even think a human
Was the one who said no to you.
I know. Because by the time like the right person seen my application, they were like, oh, hell,
This is
like,
a no-brainer. Yeah.
it's a no-brainer. Like,
Yeah.
this kid, like at that time,
Mm-hmm.
definitely qualified for this role.
Mm-hmm.
So I did that for a while, moved back to Ontario, and got that like corporate experience in that space.
Nice. Was there any lessons in that experience for you, like the experience of going to the conference and getting an interview the next day? Was it something that made you realize the importance of the individuals and the networking aspect of things?
For sure. Yeah. And I think, especially back then, I think I was like, and to today, I'm like, if I was able to put myself in that kind of uncomfortable position of like, then you have no excuse not to do it today, when it matters most, like showing up in rooms, advocating for yourself and advocating for other people, right?
Mm-hmm.
And it's nice that I was able to get that like real life experience, which I was kind of forced to do, right?
Yeah.
In that situation. I don't think I probably would have had to do it if it was like not feeling like my back was against the wall in that moment.
You were pushed into that
I was
position.
pushed into it. You know what I mean? I was
But
like,
you felt like if I can do it, and now looking back, what seems like a least or less important situation,
exactly.
then I definitely need to and should do it.
Absolutely.
When I'm in these more important situations.
Absolutely. Now it's like there's a lot more important decisions, you know what I mean? I gotta make, and sometimes you may not always hear what you need to hear.
Amazing.
Or want to hear, right?
Yeah. So you got the corporate opportunity with Tim Hortons. So you moved back to Toronto at that point?
So I moved back to Toronto.
Mm-hmm.
I do that for about like 6 months.
Mm-hmm.
And then Tim Hortons ended up being bought out by this American company called
Chapman's.
RMI, I think. Yeah, right?
Yeah.
RMI. And they wanted to kind of like reposition my career. So they wanted me to now go back to Alberta and oversee like a lot of different cities.
So like a regional manager kind of thing?
Exactly, like a
Yeah.
regional operational type
Okay.
of role. And then I was like, it's interesting enough. There's more Tim Hortons in the city of Toronto at that time than all of like the province of Alberta. So I would have to be now overseeing this entire province,
Yeah.
right?
Yeah.
Going to different parts of the city.
Yeah.
So I was like, it was a lot of movement for me. So there was actually a owner, like a franchise owner, and I was training him on his operations. So I ended up just doing like a consultancy for him and helping him start off his like Tim Hortons businesses across Red Deer and Calgary.
Nice.
Yeah.
So what were you doing in Toronto versus what they had you doing back in Alberta?
Basically the same role, but one, you'd be situated in one city.
Okay.
And
because there's so many in
there's
that
so
city
many in
you're
that
just
city,
operating in that
right?
market, yeah.
Exactly. Well, the other one is like you're doing the same thing, but like
Going all over Alberta.
they're going all over. I'm like, with those winter drives, I'm like, I'm good. Yeah.
So you took a step back from Tim
I
Hortons
took
at
a
that
step back from Tim Hortons, exactly.
Okay.
So I ended up doing some like consultancies within the industry, and then worked for Habitat for Humanity, housing project, overseeing the housing programs in Alberta. And then I went to Somalia, and kind of like everything changed over the last little while.
Why did everything change when you went to Somalia?
So Somalia, I've always really wanted to go.
Was it your first time?
It was
Were
my
you
first
were born
time.
in Canada, right?
Yeah. So it was my
Okay.
first time. I went in summer of like 2017.
Okay.
And yeah, I went there to go, meet my grandmother who was ill at the time.
Was this from your mom's side or your dad's side?
From my mom's side,
Your
my
mom's side,
mother's
okay.
mom. Yeah. And, when I went there, I was like, trying to coordinate it with my family was like proved to be very difficult because, my family's not new to like Somalia, my parents have gone, continue to go, and very connected to the country. My brother had an opportunity to go and live there for summers at a time.
Okay.
Me, I was always like in this like, uni work type of hustle.
You had your own situation going
Yeah,
on.
exactly. And when I were to travel, it would be like in and out of like, around the city and what I was comfortable doing, right? So it was like that one summer. I think I was like in Dubai, actually. A lot of people don't know this, and I don't talk about this quite often, but I was in Dubai one summer, and my grandfather had passed away.
Mm-hmm.
Yeah, Alon Haisto. And he died of like a sudden death, so it wasn't like an expected death, and I felt quite guilty about that at that time. So when
Where did he pass away?
he died, I passed away in Somalia.
Okay.
Yeah.
And he passed away while you were not there, basically.
Not there. So, when I heard my grandmother was ill, I was like, I really want to see, and this would be like my only living grandparent at the time.
Yeah.
So I took on that journey, traveled to Somalia. It was definitely an experience, right? It's the first time. It's a bit of a culture.
It gave you a reason to finally make the
absolutely. So I learned a lot about myself, my culture, family, of course, and I got to meet and stay with my grandmother in her home, helping her navigate the health systems, and then kind of realize that there was opportunities to help support, her, and now today supporting many other people.
How much time did you spend that first time you went out there?
I was there for, I'd say, a little over a month.
Okay.
Yeah, a little over a month, and then shortly came back. I'd say like within 8 months came back.
Okay.
And then over the last close to 7 years, going like half a year when it kind of adds up.
Okay.
Spending about half a year every year.
Okay, that's amazing.
Yeah.
Okay. So you said you noticed a couple of like the challenges with like the health systems over there, and you noticed that dealing directly with your grandma who was sick at the time. What were some of the things you were noticing, and what did it make you think about?
I mean, the biggest challenge for me was kind of like, I think, transcribing all of her medical records, right?
Mm-hmm.
Like, and I had the responsibility, the added responsibility now, to make it make sense for my mother back home and my family. And, what does that mean? A lot of times, like sending audio voice notes, right? Or word notes.
So your mom was still in Canada?
My mom was in Canada at the time.
Okay, so you were on the ground with your grandma, and your mom's back in Canada saying, what's going on?
Absolutely. All day, every day, right? And it's expected, and kind of like,
of course,
the reason why I was there. So
you
I
were front line
realized
at that point,
I was front line. So what I was basically doing was like charting things, documenting things, getting audio recordings, trying to make sense of, what was going on at the time. And then I was like, I need to figure out a way in where we can actually help get my grandmother to like a more specialized, doctor, right? And the idea is before we can even do that, we had to have a bit of a chart for her,
like an understanding
and
of
an
her
understanding
current
of her
health
current health
situation,
system, so I can like translate that and send that over to some specialists, right? And through that process, I realized I'm like, okay, this is actually not that hard, right? So I had this crazy idea, and I'm like, hey, we're gonna raise enough money to build out, a digital health charting system. And so, we embarked on this journey at that time, and really didn't know where it would land. And I put out a call to action on Instagram, and I was like, hey guys, we need to raise X amount of money. We need to do it fast. And alhamdulillah, it was like community showed up, and
you did a campaign, like a crowdfunding campaign at the time, right?
We did, yeah. We did a GoFundMe. We posted it, and I knew enough about kind of like how to mobilize teams. I think that's a lot of the work we do, right? It's like figuring out how do you bring people into your journey, right? So, the night before, I reached out to like select people that I knew could help, maybe had more of a platform or of an influence at that time. And I was like, hey guys,
so push the call to action.
Push it. I'm like, at this time on this day, click that.
So you were organizing, basically.
I was organizing, exactly. And alhamdulillah, like I was actually pleasantly surprised of how community showed up. And it always takes, like, I think, those like 3 to 4 people who kind of like do it first. I think other people will eventually be like, okay, either guilt trip them, you know what I mean, or they want to be part of the movement. And alhamdulillah, like I think we raised like within 24 hours like 10,000, and then about 50,000 near the end of the week.
That's a lot. Yeah,
it's a lot. Yeah. And then we ended up buying a couple of Toshiba laptops, went back to Somalia, and initially, I mean, we thought we had a really good process in place, and it ended up not working, the initial iteration of the product. And I think a lot of people sometimes shy away from being quite honest in their journey, right? And it definitely gets
What were some of the challenges and the reasons it didn't work?
I mean, I think we were just designing at that time for one clinic, right? it was a passion project. It wasn't.
Was it the one your grandma was visiting?
Exactly.
Okay.
So
Yeah.
it was like one clinic, and it was like two. So it was one where my grandma was visiting, and there's one in Mogadishu. So,
Okay.
and we weren't really thinking at that time like a lot of like the big things you'd think about today, right? And we are thinking about and tackling today. So we were like, okay, if we solve this one unique challenge, we're good.
It was tunnel vision.
It's all vision. And then we realized like, you know, hospitals started speaking to each other. People were reaching out to us.
The word was getting out.
The word was getting out. So I think, you know, being kind of, we were very scrappy in the beginning of the process, right? And now everything's more streamlined. So that's probably, I would say, one of the challenges. But alhamdulillah, like I remember like right around that time where we were doing this journey, there was a open IDEO, human-centered design, call to action, proposals with the Gates Foundation. And they were going to fund innovators to build out products and technology to address public health challenges in Africa and fund people to fail and build and fail and build. It's like,
Which is exactly what you happen to be doing at the time.
exactly. So the timing was perfect. So we didn't feel like a pressure now to like fail and lose, because they were like, okay, this is part of the human-centered design components. Travel across Somalia, get user feedback onto the products. We'll pay you to continue to iterate until there's an iteration of the product.
So
And technology.
it allowed you to go through the different iterations of the product that you needed to get it to a point where people can actually adapt it.
Absolutely. So then we traveled to like 4 representative parts of the country. We got user feedback from, you know, doctors, academic professionals, government officials, humanitarian agencies, and then we ended up finding, you know, a product that stuck. You know, that was like kind of like the clicking point. It was, okay, now this is truly something that's like designed for your end user.
Nice. So from going from, you know, corporate life in Canada to now innovating, you know, health outcomes in Somalia, what was your approach to transitioning to that? Was that a comfortable transition for you? Was it something that you were like 1 foot in, 1 foot out? Or were you like, no, I'm just going to jump all the way into this? Because you said you went for the first time to visit your grandma and then, you know, a couple months later you went back, but I know you were kind of like in between Canada and Somalia. When did you start to realize like, hey, you know, this is actually a direction that I want to take and pursue?
So I think, so I was actually working at my job while I was going back and forth. So I remember like I had some really good employers, and every year since that first initial visit, every summer or break, I'd be going back to Somalia.
Okay, so you were using summers.
I was using summers to go back. And I remember just telling them, hey guys, like I have to go back, right? And like, okay, cool, you go back to Somalia, cool. And then like second time, like, okay, cool. And then they seen an article on like CBC and Toronto Star, and they're like, oh, like
you're not just going back.
You're not just going back. Like you're building something, right?
Yeah,
like, well, what is going on? What is your like career pathway? Like, of course, every organization.
So you were 1 foot in, 1 foot out. You still were in
absolutely
corporate life, and
for sure. And then I think there got a point in which I had to like go to like all in, right? And I think that was like, I'd say about a few years ago, where we got a grant by the government of Canada, and we got some supporters by like Google, you know, MIT, and you know, humanitarian agencies who, you know, have adopted the system. So we really needed to start kind of like scaling, you know, building up the technology, mobilizing teams. It was like, you know, it was time to kind of like go full throttle and like mobilize against that demand, you know, because there was like demand coming in, and it's like there was no more time to like juggle the two. So like, you gotta like kind of thing, you gotta go full in, right? So
being somebody who was like born and raised in Canada, what is sometimes like referred to as like diaspora, you know, what was that like for you specifically going into Somalia? Obviously, it's where our parents are from. It's where, you know, you know, our history and family and things like that are originally from. But being somebody who, because for example, I grew up in California, there's a difference, you know, like you hear about it, your parents tell you stories about it, your grandparents tell you stories about it, but it's different than what you knew growing up. It's different than what you experienced growing up. So how was that for you specifically going into a market like that, that not only are you navigating now the professional aspect of building something, innovating on something, scaling something, but you're also navigating a different culture?
Yeah, I mean, that's a really good question, right? Because I think, there's like really no right or wrong approach to it. Like, I think um, it's really important, I think, to know that you don't know the challenges that the communities face every single day, right? So not to come in as like a subject expert, right? Or like I know that this is the only solution or the right solution, right? So I think when we first started, what I think helped me in a lot of ways is because I came in on not an approach of like I want to build something and this is the career that I want to make out of it. So I came in with like really, no background, in certain aspects of what the organization is today, right? I came in with like I just want to help save my grandmother,
Yeah.
right,
So
and
you
get
just saw
out.
a problem and you wanted to
Yeah,
come up with a
exactly.
solution.
And
Yeah.
that's where it was supposed to end. But because of that, I think lack of like having everything kind of sorted out or going in with a mission and saying, I want to do this and this is the life I want to make, I think I had to rely on people to help me. So the first thing we did was set up a steering committee of public health professionals in Somalia,
So working with the locals.
local communities who are driving the change, right? That was our advisory board. We didn't run anything without their, support, like governments who, of course, help, scale the product through their footprint, building local teams on the ground, local talent. There's only like 2 diasporas on the project, me being one, and there's a team of over like 20 people, right? And they're like
So there was
local,
more local influence and
absolutely,
support for the
and
project
it's
than
all
diaspora.
local driven, local led, and I mean, and a lot of people always reach out to me every day, like saying, I want to go back to Somalia and do an initiative, and sometimes I don't think people quite understand that. Sometimes you don't have to do that, right?
Yeah.
I think if I were to go back in time,
I'm glad you say that. Yeah.
no, it's true. Like,
Yeah.
I mean, if I were to go back in time, knowing what I know today is like, maybe, I mean, alhamdulillah, it kind of worked out to be something that has been truly beneficial, right, to the populations that we serve and support. But that's not the only approach to help people back home. You can like support ongoing initiatives, collaborate with ongoing initiatives. A lot of people reach out to me and say, I want to do this. And I'm like, do you know that this exists or that this is happening?
Yeah.
Maybe you can double up your efforts on this approach or serve as like a cheerleader, right, to a cause.
So what's
You know what
already
I mean?
happening? Yeah.
To what's already happening. I mean, for me, it was a very novel space. You know what I mean? There wasn't a lot happening in
That required some
that in this field at the time, so we were able to really support, that movement when it came to the health space, right? And I think because of those like intentional approaches we've taken, it allowed us now to like scale up the organization now and our footprint across many parts of the country. Yeah.
On that note, can you tell me more about what the mission is for Ogow Health?
Yeah, so our mission is, I think, 2 tiers. So one is like, getting the right tools in front of healthcare professionals and making their lives easier. So digitalization of records, right? And the second approach is to build, driving clients, which are patients in Somalia, back into the facilities. So social behavior change components, sending out audio messages for low literacy patients on where and when to go for their appointments, and SMS reminders. So really supporting the capacity of healthcare workers and administrators within the facilities, but then also making sure that, patients in their homes know the importance of their health appointments and where and when to go for their medical appointments. So really bridging the gap between the facility and the patient at home.
Amazing. So this started really as just a problem that you noticed, and that kind of transitioned into you coming up with a solution for it, and then eventually being recognized by, the likes of Google, IDEO, Gates Foundation. Can you tell us a little bit about where Ogow Health is now? Like, how many regions are you guys in? Tell me a little bit more about, we know where you started, but tell me kind of like where it is now.
Yeah, so today we are in over 12 districts across Somalia. By the end of, I think, when this podcast will be released, we'll be in close to four out of four federal member states in the country. And, we're implemented our solution in over 100 maternal and child health facilities so far. And we've done work in neighboring countries.
How does that
Yemen.
feel?
Good. I mean,
in such a short time, relatively speaking, too.
Yeah. I mean, if you think about it, I think a lot of kind of the, how would I say it, pieces to the journey happened at pivotal times and the right time. So I think the alignment was really good, right? So, I go to Somalia, I see this challenge, I do the GoFundMe, community shows up, we fundraise, we move fast, we wasted no time. We ended up building something, figuring out the challenges to it, seeing the human-centered design, IDEO, call for proposals.
So it's like right timing for a lot of things.
Exactly, and acting on that call to action. We didn't have grant writers, right? I wrote that grant, right? I'm like, I need to get this grant because I know it can help us.
This is our way out.
Absolutely. Yeah. And I know it can help us get community feedback, and that was something that was lacking initially, right? So getting that community feedback into the product, iterating until you find something that works, and then applying for opportunities, right? That's what we spend a bulk of our time is, we need supporters, we need to get fundraising in, and we need to be able to really mobilize against the demand, right? So it seems short, but it was a long journey. It's close to we're going to be 10 years in a few years, right? That's so amazing. It's like, it's been some time from when we started to today. Yeah.
That's amazing. I want to ask you something. There's a term that's used in the space, but I want you to share with us a little bit more what you think it means. What is a social entrepreneur to you?
That's a really good question because I think sometimes a lot of people don't know what a social entrepreneur is, right? Or they'll define your work kind of in not the most appropriate way, right? So really, to me at least, a social entrepreneur is someone who is pushing a mission forward, right? That is not so reliant on just a traditional grants, right? I think anybody who knows the NGO space, it is very difficult to sustain yourself on being reliant on just like grants, right? So you need to think of like a hybrid model. So social entrepreneurship allows for you to get resources, right, into your organization that ultimately go back into building and scaling your organization, right? So it allows for you to be more entrepreneurial and not so stringent. Because sometimes nonprofits, they're good, they're great. They want to do a lot of good work. I'm sure there's executives within a nonprofit. I want to push work forward, and then like their board members sometimes a bit like, slow down the process, right? Where if you're a social entrepreneur or an entrepreneur, if you see a challenge today, you can act on it right away. So you're always putting the resources towards the most pressing needs at the right time based off of your entrepreneurial mindset or your approach, right? Okay. So it allows you to be a lot more scrappy than the traditional
NGO approach.
Yeah.
Okay. What I want to ask you, working in the space of a developing nation, what is something that you learned from working in that space, and what is something that you can maybe advise to somebody who is already in that market, but wants to be able to fully transition into that market? So let's say somebody who has already been able to visit,
Yeah.
wherever their original or parents are from, and maybe they already have something going on over there, but it's something that they want to do in a more mission-driven approach. What would you suggest for them?
So I think, the most important thing I would say, at least from my experience, is kind of, building like a coalition or joining one, right? So I think the entry point should really always be, I think, reaching on to somebody that can kind of help you navigate a space, right? I think if you just go in, head in, right, two things can happen. One, you can get so discouraged, right, that you feel like you can't contribute, or you come in with your own assumptions and biases, right, and what things should look like for yourself. So, I mean, in our case, like, it was great that I think I kind of went in naive, but I was never shy enough to like ask questions, right? And I think that goes back to the early days of me having to kind of like ask and put myself in rooms. I'd be like,
Being able
okay,
to put yourself in that position.
absolutely. Like,
Yeah.
why is this happening? Is this a right approach? What do you think about this? Can you help? Can you volunteer? And just kind of like pulling people in, like building a network. And I do it to today. If I need something, I'm not going to act like a subject expert on something that I feel like somebody can help me push something
So
more
understanding your limits, basically.
100%. Like,
Yeah.
I think, and also not limiting yourself to those limits, right? Sometimes I'm like, okay, maybe I'm limited in this approach today and I can't address this today. But I'm going to get someone to help me on this today. And while they're helping me, I'm going to go be an expert or try to be an expert on the subject. So I'm not reliant heavily on people all the time. So I think that's the most important thing is like asking for help, but then also seeking those answers offline, like figuring it out at the right time. Right
Yeah.
now, things might be chaotic, right? And you don't have time to kind of like unpack
Figure it
it,
out, yeah.
but make sure you figure it out, right?
So not giving up on it.
Not giving up on
Yeah.
it, because you're eventually, I mean, the likelihood that that similar challenge is going to come up again
Is probably very
is
high.
probably very
So
high.
you shouldn't just park it
So
and
you
forget
should have
about
parked
it.
it and
Yeah,
forget about it 100%.
Man, that's amazing. So I know you said at like when you were still 1 foot in, 1 foot out, you were spending like your summers in Somalia, and then eventually you had to make the choice to commit to it.
Yeah.
I want you to tell me a little bit more about what that commitment looks like for you now, as somebody who's from like Canada. Like, are you
Yeah.
fully based in Somalia? Are you still in Canada? What does that look like? And also tell me what's to come. What's to come for Khalid? What's to come for Ogow?
So I think today what kind of like a day-to-day kind of looks like is, I was just in Somalia last month, and then prior to that I was there 2 months prior. I got to come back for a little bit, and I'm going back in a couple of weeks, right? So oftentimes what it looks like is going back based off of needs, but also kind of like, to be connected. I think right at this point we've done like dozens and dozens of like training sessions and workshops, and I've been to every single one to the point where my team is like, Khalid, you don't need to come. And for me, it's like, it's the best part of the job, right? It's like being on the ground, seeing the tablets, being given to health workers, helping facilitate, sometimes when you
Ensuring
start,
success, basically.
yeah, absolutely. And I think sometimes when you start as a solo social entrepreneur or somebody who's like doing a startup, you have to learn the organization inside and out, right? So
You have to wear every hat.
you wear every hat. So you basically know how to do a lot of the parts of the organization, right? So in your mind, you're thinking like, I need to kind of like, mobilize and do that, right? So that's basically, what I say, yeah. Sorry, there's a bit of
No, you're good.
AC, yeah.
Yeah.
So,
Man, that's amazing. So what is...
Bro, I don't want you guys thinking I'm crying up here.
Yeah. No, it happens.
AC's
It happens.
hitting, man. Yeah.
AC's hitting. It happens,
Oh, my
man.
allergies tweaking. Yeah,
No, it's just it's a very touching thing you're doing. I'm just kidding.
clickbait. Yeah.
We need more of those. No, I'm just kidding. So what's to come? I'm really I can speak for myself, you know, witnessing kind of like your journey, like you said, you're going on 10 years. It doesn't feel like it. And, you know, people always say that. I want to talk about that because, you know, they say overnight success, you know, so people kind of just see like where people are today, but they don't see like those summers and you like having to tell your corporate job that I'll be back, you know, I'm going to Somalia again. They don't see none of that, like things that happened over the last 10 years, you know? So that being said, and it's very exciting, and I definitely want to give you your flowers for like what you've accomplished so far. I just want you to tell our guests what's to come. You know, maybe what you guys have planned in the future. Where do you see Ogow Health going from here, and where do you see yourself going from here?
I think, it's probably like a lot happening, right? So right now, we're really growing out our in-country tech teams, you know, which is really cool. So like building it across the country. So initially they're like all situated in one city, but now building different teams across different
is that like
countries.
Technical support teams?
Technical call centers. So we set up
That's
technical
fire.
call centers across the country. So they're able to respond to tickets, you know, more efficiently, faster. We are now partnering with an exciting organization and humanitarian agency that's going to be announced, you know, hopefully like around the time this episode drops. So if anybody's listening to this, keep an eye out for that to come. And really building out different components of an organization, right? So things like our social behavior change programs I was talking about earlier. Initially it was like SMSs, and now we're doing a lot of, you know, audio reminders for people who have, you know, low literacy or poor eyesight. And we did like this extensive research that was supported by the government of Canada, where they actually like funded a lot of that work, which was really cool to really expand to like more rural communities and address some of those challenges. For me, I think personally, I don't know, man. Hard to say. Yeah, hard to say. I think, unfortunately, sometimes I live very, like, I think, addressing things as a reactionary, or kind of like, and you need to kind of do that sometimes. So maybe, like, slowing down a bit, you know? Like, maybe just taking some time to kind of, like, reflect. And I think it's so interesting because I told myself I'd never do a podcast in my life, right? And here we are, right? Yeah. So, you know, I've done like 2 so far, and like within 24 hours, you being the first, you know, and it really is therapeutic in a lot of ways because you never talk about your journey or aspects, and it's like it takes you back to kind of like the very start.
Slowing down, because you're going so fast, you don't realize how much you've accomplished or how far you've come. Yeah.
So now I'm like a huge advocate for podcasts because I'm just like, it really allows for you, like you said, to slow down. And, you know, when you do like a keynote or something, it's very like, you know,
jam-packed.
There's expectations. Are you going to like perform well enough? Are you going to do your organization service? Are you going to like push the organization forward? But I think to slow down and talk about the work you do is cool. It's a nice thing. So shout out to people like you, man. Keep doing that. Keep doing that work. Yeah.
Well, I just want to thank you for coming on and joining us today. I know there's a lot of people who are from diaspora communities that are interested in doing things. And I think one of the best things that you said today is sometimes maybe not thinking that they have to do something, and maybe just, you know, bigging up the things that are already being done. But I think there's a lot of people interested in, you know, Africa or wherever their parents or their original places are from. So I just want to thank you for coming on.
For sure.
Hopefully we will do this again, and the next one we'll do in
Somalia. And I would love that, man. And I think one last thing, just to kind of piggyback off what you said about diaspora communities supporting initiatives, you know, there's an interesting story. So there's a Somali in Vancouver. Her name is Yasmin. And, you know, around the time we launched our project and we did our GoFundMe, you know, she was like, you know, right now what I can help with is building a website for you. We didn't even have a website. So she built our website for free when we needed it most. And through that journey, I realized she was a public health specialist from Johns Hopkins University.
Oh, wow.
So she ended up being our first consultant ever. based off of that like willingness to like
support.
support something where she didn't even know where it would lead, right? Out of the goodness of her heart. And the fact that she did that for us, and she didn't even tell us she was a public health specialist at that time, or like she's studying public health,
Yeah, it
or
was
she had
just
this degree.
strictly
It was
like
just like I want to do the creative aspect as a passion project on the
Yeah.
side.
Whole time she has a background.
And it was
in
like us
director
the
relations.
whole time, and it was like
Yeah.
us through that conversation, figuring out like me learning more about her, and then figuring out how she can move the organization work forward. We worked together for like a good year. We stayed friends. You know, mashallah, she's based in Minneapolis right now, and she's like a huge photographer doing great things. So shout out to Yasmin if she's listening to this. Yeah.
Yeah, that's amazing. I think it's I think that's a big thing that a lot of people sleep on is being willing and being able to
Showing up.
do something without knowing where it's gonna go.
100%.
And I think a lot of people aren't ready to do that.
Yeah, for sure.
So more of that.
Yeah, 100%, man. Appreciate it.
Appreciate you.
Thanks so much,
All right,
man.
my brother.
Awesome.